Two medical groups have joined forces to try and reduce the number of opioids being prescribed for chronic pain. Painaustralia and Scriptwise say the latest data shows that strong painkillers are prescribed to 3 out of 4 chronic pain patients, and it shouldn't be seen as a first resort. Here's Carol Bennett, who's the CEO of Painaustralia. Hi, Carol. Firstly, how strong is an opioid?
Opioids can be very strong, and certainly what we've seen is a huge increase in their use, their misuse, and the number of deaths as a result of the increase in prescribing of these medications, but also over-the-counter use of codeine in Australia.
Where does that increase come from?
Look, the increase comes from these drugs being often seen as a first-line therapy, first choice for doctors, first choice for consumers when it comes to managing chronic pain. And we know that chronic pain isn't very well managed with opioids or with codeine. And certainly that's an issue, and it's an issue the federal government is tackling come the 1st of February when we'll see upscheduling of codeine so that you have to get it on a prescription. But we'll also see some further changes as other countries have in relation to how opioids are managed.
So what are the alternatives to prescribing opioids?
Well, this is one of the issues. The public are often not aware that chronic pain is not a good reason to be taking opioids, and so they tend to see them as a first line of choice. But there are very few other options. There are some, but certainly what we want to see is national leadership on this issue so that we have in place other ways of managing pain. And we know that there are very effective multidisciplinary supports for people who need access to pain management, but we have not been particularly good at national leadership in this area.
And what are the dangers of overprescription, overuse?
There are huge harms, and we're certainly seeing a lot of those harms. We're seeing people accidentally overdosing when they're using opioids and also using alcohol or other prescription medications. We've seen an increase in the misuse and the dependence that's related to these kinds of medication and all the harms that go with that. These are not safe or effective drugs for long-term chronic pain use.
But there are cases where opioids are the right answer.
Well, look, opioids are a very effective solution when it comes to acute or post-surgical or cancer pain, short-term use. But the problem is that this kind of increase in use is associated very much with ongoing chronic pain. And for that, we know the evidence suggests it's not particularly effective.
Chronic pain is notoriously hard to treat, Carol. You can understand patients who want something that's going to give them quick relief.
Yeah, look, quick and effective relief is one thing, but I guess what we need to see are more pain specialists. We need to see better responses in the community that enable people access to effective treatments. And we know that the most effective way of managing ongoing chronic pain is through multidisciplinary supports. And, we need to be better at planning and managing how we refer people and how we ensure people get access to those sorts of treatments when they need them, because clearly we have a huge demand in our community for management of chronic pain, which is really unmet, and that's why we're seeing this huge increase in use of opioids.
Carol Bennett of Painaustralia, thank you.
Thank you.